Glenohumeral labrum by Nikki Thomas, Caitlin Bath, Maddie Anderson, and Robin Enlow.
This is an example of the glenohumeral joint. As you can see, underneath the head of the humerus, in the glenoid cavity, is the glenohumeral labrum.
This is a healthy glenohumeral labrum. It's attached all around the glenoid cavity. Yeah.
Here I have attached a picture of the glenohumeral labrum. You will see it here labeled as the glenoid labrum, which is just another way of saying it. So take a moment and go ahead and locate it. Got it? Great, let's move on. Alright, this is the structure of the glenohumeral labrum. The structure is fibrocartilaginous and it's attached to the outer edges of the glenoid cavity. It is shaped in an oval to fit nicely right into the cavity. It helps to deepen the glenoid fossa, and that deepens about 1/3 with this labrum. And then by the deepening, it increases the contact area of the humeral head into the glenoid cavity. The labrum is made up of different collagen fiber bundles, and it goes in a circular pattern around the glenoid rim. The fibers do mix with radially oriented fibers at the long head of the biceps tendon, and then some parts are vascularized, while the inner portion is avascular. And then lastly, the periphery has a bunch of free nerve endings on it.
The function of the glenohumeral labrum. The glenohumeral joint has the most mobility, however, it is also the most prone to injury due to its instability. The labrum assists in stabilizing the joint. The head of the humerus is much larger than the glenoid cavity articulating surface, meaning that the surface of the scapula is much smaller than the head of the humerus, and the labrum assists in keeping the head of the humerus in place. It assists in keeping the head of the humerus in the glenoid cavity by restricting the movement of the humeral head so that it can't move like anterior or posteriorly. It can just like rotate. And it acts as a vacuum to keep the humeral head tight to the articulating surface. There is still obviously a lot of movement at the joint, but it helps to keep it nice and tight to the cavity. It is also the attachment site for the long head of the biceps tendon.
A slap lesion can occur in the glenohumeral labrum, which stands for superior labrum anterior to posterior. This is classified by a tear of the superior labrum. The long head of the biceps tendon inserts into the superior labrum. There are 10 different subtypes of this, which are all characterized by a tear of the superior labrum at the origin of the long head of the biceps tendon, but the different subtypes extend and affect different portions of the labrum and the surrounding anatomical structures. The causes of this could be chronic, in which there would be a wearing down of the labrum that occurs over time, and for patients over the age of 40, this tearing is seen as a normal process. This also could be due to fouche, which is falling on an outstretched hand, and it is seen frequently in athletes engaging in overhead actions.
This is an example of a slap lesion. So as you can see, the long head of the bicep tendon is pulling on the superior portion of the glenohumeral labrum, and it is coming off of the glenoid cavity.
The 10 different subtypes of slap lesions are shown here. You can see that the table shows the different descriptions of where the lesions affect the arm, and an MRI is used to diagnose the different lesions. In this slide, you can see a slap lesion type 2 example, where the picture you're viewing the glenohumeral labrum from a lateral and slightly posterior perspective. This is the most commonly encountered slap lesion, which it's classified by a stripping of frayed superior labrum and attachment of the long head biceps tendon from the glenoid. And this is associated with repetitive microtrauma, which is seen prevalently in overhead throwing athletes. And there are 3 different subtypes for this type 2 example, which the different subtypes are classified by their origin. So, for example, slap lesion type 2A is classified with anterior superior labral lesion, where subtype B is posterior superior lesion.
Another injury that can happen to the labrum is called the Bankart lesion. This is an injury of the anterior glenoid labrum. It happens from anterior shoulder dislocation. Symptoms can include pain when reaching over your head, pain with daily activities, and instability and weakness. Usually your range of motion becomes very limited, and there's some instability or giving out of the shoulder. Most young patients who do dislocate their shoulder will have this lesion.
This is an example of a Bankart lesion. It happens on the inferior anterior side of the glenoid cavity, and it's a tear from dislocation.
And here are our references. Thanks for watching.